Hola, buenas tardes. Para esta junta vamos a tener un intérprete en español. Si le gustaría escuchar en español, solo abajo de su computadora en el taskbar, hay como un mundo que dice interpretación, solo clic en ese botón y elija español.
Thanks, Sparta, and thanks, David, for helping us out. Mhm.
Great. Well, I will kick us off just by welcoming everyone. Thank you so much for being here today. It's already a struggle Monday. Hey, but we'll get through this and it'll be a good day. We got a full agenda today, but for those of you that don't know me, I'm Sherry Corey. I'm the Director of Development and Engagement for Quality Health Network. We are a Contexture affiliate, but I am also the board chair of West Mountain Regional Health Alliance. So we are excited to have you here today. And again, we've got three great speakers today that are going to join us and give us some information that's going to be very helpful. And I have the honor and the privilege of introducing Adam Fox. So Adam, thank you so much for joining us today. And so as I read his introduction and bio, if each one of you could put your name and your organization in the chat, that would be very helpful. But again, Adam, thanks so much. Adam serves as the Deputy Director of the Colorado Consumer Health Initiative, better known as CCHI, where he has worked since 2011. He has developed deep policy expertise across a range of health policy topics and uses that to advance affordable and equitable healthcare for Coloradans. Adam is currently leading the Protect Our Care Colorado Coalition and campaign to push back against devastating cuts to Medicaid and the ACA. Adam also serves as a board member of Connect for Health Colorado, as chair of the Colorado Option Advisory Board, and as a consumer representative to the National Association of Insurance Commissioners. So, Adam, thanks for joining us. I'm going to hand it over to you.
Awesome. Thanks. Let me just get my slides up here. And before I jump in, I do want to make sure that folks know we will send a link to these slides, so you don't need to feel rushed to capture things, especially because some of these first slides I'm going to run through fairly quickly. Is everybody able to see my slides okay?
Yes.
All right. So as Sherry indicated, I work with the Colorado Consumer Health Initiative, or CCHI. We are a nonprofit, nonpartisan membership-based organization that tries to make healthcare more equitable and affordable for everybody in our state. We do a lot of advocacy at the state capitol and at the state regulatory level. We also run a consumer assistance program that can help folks navigate medical billing issues, insurance claim issues, all of those fun things. And then we do a lot of community engagement, organizing, and education as well. But a lot of what we do is build coalitions and work to try to advance policy that is going to benefit Coloradans. So I'm going to start with sort of the budget situation where we are sort of at the state level, take a little bit of a look at sort of the funding that we get from the federal level, and then we'll dive into sort of the cuts that are being discussed and what those potentially mean for Colorado. So we all know that healthcare is a big chunk of Colorado's state budget. This is the first year that it has surpassed K through 12 education. And part of that is because of sort of increased expenditure on long-term services and supports through Medicaid. That 32% in our state budget is predominantly Medicaid, though some of it is also for the Children's Health Insurance Program and a few ancillary programs. We also all are probably pretty well aware that the state budget is running into a lot of challenges right now. The legislature is trying to find a way to close a $1.1 billion gap in our budget that is largely generated by the limitations that are imposed upon us by the Taxpayer Bill of Rights, more commonly known as TABOR. And just to give you an idea, for this budget year alone, Colorado would have at least 500 million more to spend if we didn't have the Tabor cap to contend with. But I would also flag that we have sent quite a bit of revenue back to Coloradans under Tabor because we kept hitting that cap in recent years. 1.6 billion last year alone and 8.5 billion since 2022. So essentially, we are finding ourselves in a situation where the structural constraints and deficit that is sort of created by Tabor means that we're not bringing enough revenue in to fund the programs and services that Coloradans need. And I want to remind folks that Tabor has been in existence since the early 90s. And basically since then, there have been no statewide increases to tax revenue, except for a few minor exceptions, mostly around sin taxes like marijuana. But you tie that in with some of the uncertainty that we're seeing at the federal level, and it creates a really potentially devastating picture. And then with the tariffs and everything else that's happening in the economy, it just sort of adds another layer of conundrum that we are potentially going to have to face. So when we look at sort of the funding that Colorado gets from the federal level, we get quite a bit of funding, almost a third of sort of the state expenditures from federal funding. So that $12.5 billion is coming from the federal government. And the vast majority of that, 72%, goes to healthcare policy and financing. For Medicaid predominantly, but also the Children's Health Insurance Program. So the vast majority of those federal funds are going to healthcare programs that are vital for our state. So that brings us to the conversation that's happening in DC right now. Both the House and the Senate have been working on budget propositions to essentially cut various programs or amounts of money in order to pay for tax cuts that were passed during the first Trump administration and largely benefit the wealthiest individuals and big corporations. What they are talking about at this point in time is at least $880 billion in cuts from the Energy and Commerce Committee. 92% of what that committee oversees is Medicaid. So the vast majority of those funds would have to come from the Medicaid program. And I want to remind folks that that 880 billion is the floor, not necessarily the ceiling. We saw a variety of sort of menus of potential cuts that ranged up to $2.3 or $2.6 trillion in cuts to Medicaid. There's also the potential of additional cuts to various aspects of the Affordable Care Act, though those seem to be relatively safe for now. I can't say that with a lot of certainty, but I think we will see how things play out there. And then also want to flag that there's roughly 300 some odd billion that they are also proposing to cut from SNAP, school meals, and TANF programs. So again, all of this is to sort of extend the tax cuts that were passed during the first Trump administration and essentially pay for them. But what this would really do is it would harm lower and middle income Colorado families and shift those funds to wealthier individuals. That is the fundamental structure of these tax cuts. And when you sort of layer in the cuts,
I'm glad you're back. How'd it go?
Thanks for muting. It lays a pretty grim picture as to how most Coloradans would be impacted. So the House and the Senate have both passed a unified budget resolution. The House passed theirs on Thursday. The Senate passed theirs last week, Saturday. And what that means is that they can start the reconciliation process that allows them to pass these budget changes with just a simple majority. And that's particularly important in the Senate, where Republicans have a very slim majority and need a mechanism to get around sort of the 60 vote filibuster that usually exists. So they are going to be starting this process when they come back from recess. They are currently in recess for the next 2 weeks. So there's going to be a lot of activity happening in these 2 weeks, but they will have to start to really put pen to paper and actually say what they are intending to cut when they come back to DC at the end of April. Just to remind folks, there are about 1.2 million Coloradans who are covered under Medicaid and CHP Plus. It's a little over 1.1 million in Health First Colorado or Medicaid, and the rest in CHP Plus. There are 282,000 Coloradans enrolled through Connect for Health Colorado, some additional enrollments that we have been able to generate through some state policy innovation through the Health Insurance Affordability Enterprise, particularly for undocumented folks through the Omni Salud program. And then you have small and large employer plans. So anything that potentially touches the ACA affects these latter three buckets. We're not going to dive into that because at the moment, there don't seem to be too many risks there, though I will highlight one at the end of the presentation. So just to give you all a bit of a picture, these are sort of the percentage of the population in your counties that are currently covered through Medicaid, the average number of residents, and the average Medicaid expenditure. To put the $880 billion in context, that is roughly a 10% or more reduction in Medicaid funds. So you have to think about sort of how that reduction might play out across the state. But I want to emphasize some of the way that they're talking about the cuts could actually lead to greater cuts at the state level. And we all know who our congressional delegation is, but really there are a couple key Republicans in Colorado who we are trying to communicate with and try to help them understand what these Medicaid cuts would really mean for their constituents and their districts. Especially those with the particularly high percentage of Medicaid enrollment, and those would be Representative Evans here on the Front Range, and then Representative Hurd, which affects you all. So what they are currently talking about as some of the potential cuts that they want to bring forward are things that they are generally categorizing as fraud, waste, and abuse. In general, what they are categorizing as fraud, waste, and abuse is not fraud, waste, and abuse. So I think we need to be clear about sort of what that means. But some of the ways that they are talking about Medicaid cuts would include things like implementing work requirements. We know that the vast majority of people who are able to work, who have Medicaid, do work. So nationally, it's estimated that at least 92% of people on Medicaid either are working, they have a disability and are unable to work, are in a nursing facility, which in Colorado is Medicaid covers about 61% of people in nursing facilities, nursing homes. Or they are going to school or are a care provider for a family member who is on Medicaid. So in general, work requirements are like, they're not necessarily on paper, they wouldn't necessarily affect that many people. The issue is how those get implemented, because We all know that the Medicaid system and the benefit management system in Colorado is not the greatest. And what it would do is it would put up additional administrative barriers really for all enrollees, because it would require any enrollee who might qualify for an exemption from the work requirements to provide additional documentation and be able to document that exemption. So it will create more paperwork, more administrative burden. And since Colorado is one of the few states that has county level administered Medicaid, it will have a big impact on county administration, and really likely increase costs dramatically for administering Medicaid. In states that have implemented work requirements, they end up spending millions of dollars to kick people off of Medicaid who meet otherwise all the qualifications to have coverage. They're also talking about disallowing or changing some of the parameters for provider taxes or fees. In Colorado, we have a hospital provider fee that is essentially the mechanism we use to cover all of our Medicaid expansion population, plus a few additional other expansions in the Medicaid program. So roughly 427,000 Coloradans are covered through the mechanism of the hospital provider fee that we then get federal matching funds from. This has also allowed Colorado to increase hospital reimbursements substantially, which is important for their sustainability, particularly in mountain and rural areas. They're also talking about just flat out changing the federal matching rate for the Medicaid expansion population. Under the Affordable Care Act, the federal government pays 90% of the costs for expanded Medicaid, and the state pays 10%. So under the hospital provider fee, we're raising the 10% that we need to kick in from the state level. But they're talking about changing that matching rate to a 50-50 ratio. And it's highly unlikely we would be able to use the hospital provider fee to raise enough funds to meet that 50% match. So this cut or change alone could potentially end Medicaid expansion in Colorado. They're talking about a variety of other potential changes. We have always heard about per capita caps on different elements of the Medicaid program, all of which is really problematic, especially when we think about the conversation that I started with around Colorado state budget. And they're also talking about targeting states like Colorado that have started to expand Medicaid or Medicaid-like programs to folks regardless of documentation status, and essentially penalizing states like us and cutting our funding. So the short of it, because of our state budget situation, there's really no way that Colorado can respond if these federal cuts move forward. Any cuts at the federal level will lead to dramatic cuts at the state level. Exactly how that will play out and which populations will be affected, we can't necessarily say at the moment, but if we were to lose the hospital provider fee dollars themselves, that would be a loss of another $1 billion a year. And as I said, that would essentially end the Medicaid expansion, which covers roughly 400,000 Coloradans. We know that many hospitals and clinics, especially in rural areas, are struggling following the Medicaid unwind and end of the public health emergency. And this would put them at extreme risk of reducing services or potentially closing operations altogether. And then there's sort of the broader economic fallout that I think we have to talk about. A recent study from the Colorado Health Foundation found that for every $1 million lost from the federal government for Medicaid, Colorado loses 2.2 million in economic activity. It risks thousands of jobs. And we would lose 825,000 in added household earnings across the state. So if you think about what $1 million loss looks like and extrapolate that to $1 billion or $1.5 billion or whatever these cuts ultimately look like for Colorado specifically, it could be devastating. So this is the one piece that I wanted to talk about related to private insurance coverage through the Affordable Care Act. This is not necessarily a cut that's being discussed in the budget resolution process, but hopefully it is something that will get fixed through the budget process. That is something we are advocating for. Enhanced premium tax credits, which started during the COVID pandemic, first under the American Rescue Plan and then continued under the Inflation Reduction Act, expire at the end of this year, at the end of 2025. What will happen if these tax credits expire is that 80% of the Connect for Health Colorado enrollees who currently receive financial assistance will see a dramatic increase in their out-of-pocket premiums for private insurance. Statewide, that's on average of a 50% increase in their out-of-pocket premiums, but in some rural areas, it will be even higher, around 70% on average. And that would start January 1st. So that would immediately impact this coming open enrollment that starts November 1st. Oops, I forgot to update this number. I pulled from a different presentation, so I apologize. I can get some county-specific enrollments for you all for Eagle, Pitkin, and Garfield. But this is another sort of looming cut, in a matter of speaking, that would just add to the calamity of Medicaid cuts. So as Sherry highlighted, we have been working with our Protect Our Care Colorado coalition that we ran during the last attempt to repeal the ACA and to cut Medicaid coverage back in 2017, 2018, and beyond. We've sort of revived all of that infrastructure. We have a website with a lot of tools, graphics, fact sheets, call scripts, email forms. The letter that we sent to our congressional delegation this morning, really urging them to oppose any cuts to Medicaid. We are looking to really collect stories from Coloradans who would be impacted, and we need help doing that. We have a story form on the website, and we're urging anybody and everybody to communicate in whatever ways they can with their congressional offices. So I will leave it there and happy to answer a few questions. I do have to jump off at 12 or shortly after.
Thank you, Adam. Yeah, and if anyone has questions, if you don't have audio, you can put them in the chat as well. But we'll give it a few minutes in case anyone has questions. Appreciate all that great information that you brought to us today, Adam. It's good to just remind us of what's out there. What is Colorado doing? So thank you for that information. Any questions? I don't think I can see everyone, so I'm really going to rely on Teams. Okay, looks like we do have a question. Oh, share your slides. Look like there is a link. Adam did share a link to the slides.
Yeah, and I will update those with sort of that last slide around enhanced premium tax credits. I will update with Eagle, Pitkin, and Garfield numbers.
Great.
Well, thank you, Adam, for taking time out to do this. I really appreciate it.
Yeah, my pleasure. If folks do want to get involved in other ways, feel free to reach out. I'll drop my email in the chat, and happy to collaborate in any way that folks are interested.
Thanks, Adam. All right. Well, I think, Christina, you're up next with the West Mountain Regional Health Alliance updates.
Yeah, great. Thank you. Just a moment. I'm going to share my screen. First of all, I just want to welcome all of you. I see lots of faces and names that I know, and happy to have you all here in the room today. I'm going to keep my update fairly short because I want us to focus on our awesome speakers that we have coming up. So just a moment. Are you guys seeing that in presentation mode or regular mode?
Regular mode.
Okay, thank you. Okay, so just this, we talked about this last time, but I just wanted to bring this back. Some of the things that we're focusing on in 2025, and we're really building upon the successes that we had in 2024. I think telling the story is so important right now. Having these speakers is helping to tell the story of what's happening in our region. West Mountain also wants to continue to do that so that we can support all of you in the work that you're doing to support people and services around health and social determinants of health, such as food and housing security and homeless response. And then continuing to create that impact that we can show, which will hopefully allow us to bring in new funding and new partners as it may be more difficult, as we've seen from the federal side and even potentially the state side, due to if cuts look the way they could be anticipated. So I really wanted to just take a moment and say thank you for all of you, because I know the work that you guys are doing, and I know it has been a tough 3.5 months. There's a lot changing and a lot of uncertainty, but I think as we work together, that's going to make the biggest difference. And I want to thank all of you as partners. I want to thank the West Mountain Board and the staff. We're continuing to do everything we can to support you. And please reach out if there's other ways that we can be supportive, and also that kind of thing would be great. So finally, I'd love for you in chat to share a couple things. I'd love to share a success, because it's always good to acknowledge what's still successful and what's working well. Share a challenge. I know there's many, but what's kind of the one that you're most concerned about at this moment? What ideas do you have for future quarterly meetings? And so we'll circle back after our presenters for a quick discussion and just kind of see where we have some similarities and how people are feeling. And then I just wanted to make sure that you guys knew about the quarterly meeting schedule. So our next one will be July 14th, and that will be a hybrid, in-person and online. And then October 20th will be in-person only. And so we asked you to RSVP for both. And specifically on October 20th, we're going to be doing a celebration of 10 plus years of West Mountain Regional Health Alliance. And so we'd love to have you there. This will be an excellent opportunity to have conversation, celebrate, commiserate, whatever we need to do. And looking forward to seeing people in person, either in July and definitely in October. Any questions for me specific to West Mountain? I know I'm not covering a lot of program type things, so I'm happy to answer any questions before we move on to our next speaker.
Christina, this is Annette. Just real quick, do you have locations for those two meetings just yet?
Good question. I'm gonna have to ask Cindy if we've put those in yet, but we're gonna look at probably Mortgage most likely.
Okay.
Yeah, very likely we'll be in Mortgage Commons in Glenwood Springs.
Yep. And if that changes, we'll let people know as soon as possible. Okay. All right.
Christina, would you mind putting those questions into the chat for everyone?
No problem. Thanks, Mike, for that. Thank you for reminding me. Awesome. I'll put those into chat. But first, let me introduce our next speaker if there's no other comments or questions. Okay, great. So our next speaker is Dayana Leyva, and she's the policy manager at the Colorado Blueprint to End Hunger. Sorry, it's tough to talk today for some reason. She leads federal food policy initiatives. She holds a master's in public health with a concentration in policy and health systems and is a certified health education specialist. Her expertise includes federal nutrition programs, community engagement, and power building, and cross-sector collaboration to improve public health benefit systems. And I know Diana and Adam often work together, so she may be able to answer some of the questions around some of the highlight the things that work together in these in health and food security. So without further ado, I'd like to welcome you to present to the group.
Thank you, Christina. Let me make sure that I can share my slides. Yes. Right. Let me get set up here. All right. Everyone see this slide deck?
Yeah, I can see it.
Yeah. Wonderful. Well, thank you all for inviting me to be here today. As Christina mentioned, my name is Dayana Leyva. I use she, her pronouns, and I'm the policy manager at the Blueprint to End Hunger. And I will be going over a little bit about state and federal food policy and what it looks like here in Colorado. I will note that this presentation was co-created with our policy director, Greta Allen, who isn't here with us today. And folks can drop questions in the chat as I go. That is totally cool with me. So first, I want to do a little bit of level setting on what it means to participate in policy and advocacy. So advocates are really essential for social movements, and it is necessary in order for us to be involved in the policy process to ensure that we can get things moving along. And it is how we change our systems and address issues that impact our communities directly. Traditionally, we see that policy making, whether it be through legislation or rulemaking, has traditionally left out community and focused really on extracting lived experience without actually involving folks in the process. And so at the Blueprint, we try to encourage as much community engagement, intentional community engagement as possible when we talk about policy and advocacy. We also want to emphasize that building a relationship with your policymaker is important. You have the right to talk to them, schedule meetings with them, send them letters, call them, or share issues that are important to you without an organization needing to moderate that. And we really encourage that at the Blueprint in building capacity for folks to feel comfortable either engaging with their legislators at the state level or even at the federal level, and doing this on their own behalf without an organization being involved. And it is really important that you are there at the table to provide your insights when it comes to issues that directly impact your community. So I'll start off with a little bit about what we are watching in the state legislative session. I won't go into too much detail here, but I will call out a few policies that are directly related to what is happening federally right now, and also show you all what our policy priorities are in case there is any intersection with the work that you are doing. So the Blueprint policy priorities can be divided into 3 buckets. So you have food sovereignty, which is equitable access to healthy, affordable, and culturally affirming food as a basic human right. Our organization believes that Colorado communities have the power to choose what they eat, where it comes from, how it's grown, when it's available. So in this bucket, you will see any policies that relate to nutrition incentive programs, such as like the Double Up Food Bucks program, anything that incentivizes local food purchasing for healthy eating. And then you'll also see opposition to anything that restricts food access or purchases in relation to like SNAP restrictions, for example. And also you'll see here anything related to expanding access to programs via land access or capital that would really support local producers and local farmers who are traditionally left out of our food systems. In the second bucket, you'll see everything related to nutrition program administration. So here specifically, you'll see school meal programs. You'll see SNAP or WIC involved here. At the state level, we're following a Healthy School Meals for All, and I'll show y'all a little bit more about the policies that fall into this bucket. And then in the last bucket, we recognize that food access does not exist in a silo. There is intersection between an individual's ability to access food and whether they have healthcare, housing, or whether they have a job. And so here we do look at policies at the state level related to price gouging, for example, or any necessary documentation needed to access certain programs. And then federally, we look at economic policies such as the Earned Income Tax Credit and the Child Tax Credit, which we know are two strong anti-poverty laws that we are monitoring closely and directly impact someone's ability to access food. And so I want to highlight these three state bills that we are watching as they fall into our nutrition program administration bucket, and there is overlap with what is happening federally. So the first one is the Restaurant Meals Program, and this is led by our organization. This bill would expand access to SNAP usage for certain populations, specifically folks with disabilities, folks who are unhoused, and those who are elderly, to be able to use their SNAP benefits at participating restaurants. So this is a state opt-in program. It is run through the USDA. Only 9 states currently have opted into this, and we are trying to become the 10th state and have Colorado participate in this. And the bill really just sets a timeline for our state agency to apply. Federally, there are ways that we can advocate to improve this program because currently there's not a lot of support given to states to implement these programs. There is an upfront cost for restaurants to be able to opt in to this program and participate. And it really falls on the state to be able to cover those costs without any federal support. So there is attempts to try to improve the program. There was a bill introduced last year by Congress to enhance the technical assistance offered to retailers to be able to offer this. But right now, it really relies on our state being able to support retailers. And y'all just heard Adam talk about Tabor, and I will talk about Tabor as well a little bit. But that is a big piece for us being able to kind of really make this program strong. So currently this is waiting in appropriations. We actually have our hearing tomorrow, and I'll provide some action items for folks if they'd like to learn more and advocate for this program. The other bill that we are watching, which may be familiar to a lot of folks in this space, is Healthy School Meals for All. This is led by our partners at Hunger Free Colorado. So currently, unfortunately, the program is facing a budget shortfall and is essentially going to run out of funding in December of this year if voters don't vote on 2 referred ballot measures that would raise more funds and allow the state to retain more funds for this program. Thanks, Tabor, again. And so it's important to note that there is a federal piece to this because the reason that the Healthy School Meals for All program is able to run the way that it does and is still facing some shortfalls is because we have federal funding for certain school districts. So there is this thing called the Community Eligibility Provision, or CEP, which allows school districts that serve a certain threshold of low-income students to offer free lunch to their entire student body population. Currently, that threshold is at 25%, which is rather low and good because we can get more schools to opt in. But if there were changes federally through this administration that would increase that percentage, we would see less schools being able to opt into that. And so then Healthy School Meals for All at the state level would have to cover that gap, which would be tough because we're already facing a shortfall for the program at the state level. So that's something to keep in mind with that kind of connection between the federal piece and the state piece. And then the final one, which this one's kind of new, and we found out about it last week, is around SNAP outreach funding. This is a budget item. So Currently, the state provides a 500K match for SNAP outreach, and the federal government matches it 1-to-1, so another 500K. So we have $1 million in funding for SNAP outreach. Unfortunately, we found out that SNAP was this was cut from the budget because of our budget shortfall here at the state. And sorry, I was just checking the chat, making sure my tech was okay. And so we found out about this last week, and that would mean that we would lose our federal match as well. So if the state can't match it, we lose the 500K that we get from the feds. So essentially, it's a $1 million cut. So no money for SNAP outreach. This would impact many local organizations that do SNAP outreach. So if you're a WIC clinic, a food bank, a family resource center, that gets funding to enroll folks in SNAP and educate folks around SNAP, you may experience funding cuts because of this. Fortunately, it seems like there's some efforts right now by a few legislators to get that funding reinstated, and it is not 100% yet. But for more information on kind of how to get involved with this advocacy, the lead organization is Hunger Free as well, since they are the state kind of bucket, or the state org that manages SNAP outreach. Now, y'all heard about Tabor already, so I won't get into too many details here, but you've heard from my colleague Adam just about how Tabor works in our state and how it really limits a lot of what we are able to do at the state level. And Tabor does have an impact on what we do in food policy. So all the policies that I shared in my last slide are either indirectly or directly impacted by one of these 4 Tabor provisions. Healthy school meals for all, specifically around, the ability to raise revenue and limit revenue collection. Our restaurant meals bill, we don't have enough money in the state. So again, the revenue collection piece plays a role there because we aren't able to make the program what it is. And we're hoping it gets out of appropriations tomorrow, but we'll see. But really, it comes down to the fact that the state budget cap that is calculated on this formula, inflation plus population growth, is highly flawed. And any revenue that exceeds that cap has to be returned to taxpayers. So Tabor has a huge implication on kind of how we are able to do food policy here at the state level. And so just a reminder from what Adam shared, we have a really big shortfall of over $1 billion. This is before any federal funding cuts. A third of our budget here in Colorado is federal funding. So this is a huge concern for us in this space as well. And as we work cross-sector with our partners in healthcare and housing and in other areas as well. So here are some action items for our state policy piece. So if you are interested in learning more about restaurant meals, you can reach out directly to me. You can contact your representative to vote yes for a final vote, or your senator for support when it gets to the Senate. For Healthy School Meals for All, you can reach out to Anya at Hunger Free Colorado. She is lead for anything related to that. And then another thing is the Blueprint does host a bi-weekly state policy committee. Right now, we're in a bit of a transition with our policy director leaving, and we've just hired on a new policy director who usually runs these meetings. But if you would like to be added to our listserv, you can reach out to me directly, and I'm happy to loop you in, and you can learn about all the cool stuff we're doing at the state level. Any questions before I move on to federal policy? Right. So federal policy, what are we watching in this area? So one of the things I wanted to kind of flag for folks is around some of the USDA program cuts that we saw with the whole federal funding freeze. This was driven largely by President Trump's executive orders, which put several programs on pause for review against for compliance against his newly signed executive orders, most of them having to do with diversity, equity, and inclusion. And even though that this was deemed unconstitutional by several courts, we are still seeing that several programs are being withheld funding. And these are some of the ones that we have been following closely at the Blueprint, and it is not exclusive of all the programs that are being impacted. So I'll have that as a little disclaimer. But the first one that we are looking at and we're really concerned about is the Emergency Food Assistance Program, or also known as TFAP. There was a $500 million cut to the program, which is half of the funding for this program. This program supports food banks by providing foods for very low income households, and it is a way for food banks to supplement and support other families. And this also impacts farmers and local producers, since 100% of the foods used in this program are American grown products. So this program has been around since 1981 and is not new. And so this is something that we have been closely monitoring and working with our partners at Feeding Colorado to identify advocacy and action items for our network. The other two programs are the Local Food Purchase Agreement and the Local Food for Schools Agreement, LFPA and LFS. So LFPA got a cut by about $500 million, and this would have funded food banks to be able to enter into agreements with local producers. This is a Biden era program, which is why we think it was targeted, because this was not a congressionally appropriated program. Neither of these were congressionally appropriated, and it was up to the discretion of the USDA secretary to fund. But these two programs were crucial for local producers to get their products into food banks and into schools as well. So we did see a cut here for both of these programs. And I'll share a little bit about kind of what is being done here currently. So we did notice and learn from our partners that several of the contracts that were signed and in effect were completely canceled or frozen, and these producers never received the funding that they were promised through these contracts. Thankfully, Senator Cory Booker out of New Jersey did introduce the Honor Farmer Contracts Act, which would essentially immediately re-implement any agreements or contracts that were already entered into and pay any past due amounts for these farmers. As many of you may or may not know, farmers usually plan out what they're going to grow months in advance. And so this was really tough for partners of ours that had all these plans in place ready to sell or to deliver to schools or to food banks, and then got their contracts canceled. So we are in support with Senator Booker to ensure that this is honored, but we are closely monitoring this. If you're interested in learning more about other federal programs related to the USDA program cuts that have been directly impacted, highly recommend the Civil Eats Food Policy Tracker. You can filter by whatever program or topic area you're interested in, and you can see other programs that were impacted by the federal funding freeze. So now I'm going to move into some of the bigger pieces of legislation that we're monitoring overall, and that kind of impact a lot of the work that we're doing. So the biggest one is the Farm Bill. So the Farm Bill is a packet of legislation that is passed once every 5 years. And it's basically our entire food system into a giant package. The last reauthorization of the Farm Bill was in 2018, which expired in 2023. That was nearly 2 years ago. So we are currently on its second extension of that 2018 bill, which is set to expire in September of this year. So what does not reauthorizing it mean? Really, it means that programs can't be improved or enhanced in any way. Everything just kind of stays stagnant. For nutrition programs like SNAP, for example, that falls into the Farm Bill, since it is an entitlement program, the funding does shift as the needs of the program, so that doesn't need to be appropriated by Congress. But there can't be any changes to how the program is run or anything like that because of the lack of reauthorization. So currently there's not any talks about renegotiating a new Farm Bill yet. So we are closely monitoring this, and it'll probably start at the end of this year. But yeah, we really need a new Farm Bill is the goal here, is we can get a new Farm Bill passed at the end of this year. The other piece is around appropriations. So this is funding that is allocated yearly to certain nutrition programs that are not entitlements. So a big one that we monitor here at the Blueprint is the WIC program. So the WIC program, thankfully, received an additional $500 million to keep up with projected caseloads because Congress has not been able to finalize a final fiscal year 2025 appropriations, which we're in currently. We had a continuing resolution that passed last month, which would have kept the same funding levels for all programs that are appropriated through this process from last fiscal year, which ended in September, through the end of this year, which ends in September. This is not ideal, as you know, program cost increase. But thankfully, WIC was identified as an anomaly, is what they call it, and given the additional funding to keep up with the projected caseloads. Now, that is not the case for other programs like the Commodity Supplemental Food Program that did not receive additional funding. So that program's going to probably experience a shortfall. And you just learned how the Emergency Food Assistance Program got a cut as well. So while we can celebrate that WIC is okay through September, there are several other programs that were impacted, not just in the food space, but across sectors as well, because they weren't given additional funding. And then this is the biggest one. This is the one that we are closely following, which Adam shared a little bit about as well. And it's kind of the hot topic right now for a lot of folks, which is budget reconciliation. This is just a little bit of a primer about what budget reconciliation is. Really, it's a process used to advance fiscal legislation. So it's used to pass tax, spending, or debt limit increases, and is used when one party controls like all three chambers, which in this case, Republicans control House, the Senate, and the presidency. And it doesn't require that 60 vote majority in the Senate, which is an easy win for whatever party is in power. And some examples of how it's been used in the past include the 2017 Tax Cuts and Jobs Act, and then the American Rescue Plan and the Build Back Better Act with President Biden. So far, this is kind of where we are. The Senate and House have passed their budget resolution or their blueprint, which call for deep cuts to programs like SNAP and Medicaid. And so that like budget blueprint now is going to their respective committees to make the cuts, right? And that was kind of the instructions. And this is something that, we have been monitoring very closely because it does call for at least $230 billion in cuts in the House Ag Committee, which is where SNAP lives. And that is where we're going to see likely most of these cuts come from. And really, this whole budget reconciliation is an attempt to extend the Trump administration's tax cuts from 2017 that I showed you in the last slide, which would really only benefit like the top earners in our country. For example, extending those tax cuts would give households with incomes in the top 1%, making $740,000 per year, an average tax cut of $62,000 a year, which is more than the total income of most households that are at risk of losing Medicaid or SNAP in this case. So really meant to fund those tax cuts and also to fund a lot of what this administration is trying to do with mass deportations. So I created these like buckets of kind of what the threats to SNAP are. and kind of how they fall and where we could see impacts. So the first one is around benefit cuts. So we've seen House Republicans in the past bring this up around rolling back an update that was made to the Thrifty Food Plan, which is one of the formulas that is used to calculate benefit amounts for SNAP, and essentially rolling this back to the pre-2021 levels so it can't rise with the cost of food prices, the actual cost of food prices rather than inflation, would mean that the monthly benefit amount for most individuals on the program would be lowered. So we have seen that this could amount to from a $6.20 a day per person to $4.80. So it's already not enough to cover a meal for one individual per day at $6.20. Can't imagine what it's going to do with $4.80. We have seen that in Colorado, this would amount to $380 million in cuts over the next 10 years, if this is one of the ways that they kind of amassed that $230 billion in cuts that they have. The other bucket is changes to eligibility. So harsher work requirements. Adam talked a little bit about how that would look like for Medicaid. So increasing the age limit. So currently SNAP does have a work requirement already for able-bodied individuals without dependents. So making it more difficult. So increasing the age limit and also limiting states who have opted in for certain waivers, eliminating the requirement if unemployment rates are high. To do so. This would specifically impact like more mountainous and rural areas since seasonal work is common. There are higher unemployment rates. So by eliminating that ability, more folks would be booted off the SNAP program. And then the second bullet point, I'll talk a little bit in my next slide. And then the last bucket is around state cost sharing. This, I think, is the worst part because we talked a little bit about how Tabor limits our budget already, but really requiring a state match for benefit costs. So currently the federal government covers 100% of benefit amounts for SNAP. So the state contributes nothing. So by requiring that state match, our state budget would have to make up any cuts from federal funding. And as you all know, we have a significant budget shortfall. We cannot afford a cost share. So if there's a 10% match, that would be $1.2 billion coming out of our state budget, and then $3 billion if it's 25% over 10 years. So we would not be able to cover that. So essentially, less people would have access to the program. And this is the Spanish slide that I'll share with folks after the fact. And so I wanted to expand a little bit on the second bullet point that I had up there around eligibility changes, because we tend to talk about SNAP as its own program, but it impacts a lot of WIC and Medicaid enrollment as well. One of the proposals being talked about is the elimination of the broad-based categorical eligibility, which is BBCE. This policy allows states to adjust income and asset limits for programs. And it creates a better pathway for folks that are eligible for SNAP to also be eligible for WIC and Medicaid. So reducing that administrative burden. So eliminating this would put more administrative burden specifically for WIC clinics, which rely on this. So if someone's eligible for SNAP, they probably are eligible for WIC or for Medicaid. And so it helps to get the process going a little bit better. So for WIC clinics that already have these high caseloads and staffing shortages, they will see more administrative burden. Currently, we have an estimate that 3.1 million individuals would lose SNAP if this were eliminated. This is a 2019 number, and this is likely outdated because several states have opted into this in the last few years. And over 359,000 infants and preschool age children would be at risk of losing WIC if this were to go into play. And so have some action items for folks. I lead a federal policy committee space, also bi-weekly. So if folks are interested in kind of keeping up with some of the things that I shared, feel free to email me. We also have an action alert and mobilizing listserv. So if you would like to sign up for that, whenever there are events specific to certain districts, I will reach out to folks that live in those districts to mobilize folks. We also have a call script if you would like to advocate for SNAP on your own that you could use. And then we also have an action alert from our partners at Hunger Free to reject any cuts to SNAP, which is in alignment with our own platform, and school meals. Additionally, I wanted to shout out that we do have a policy tracker on our website that tracks both state and federal policies. So if you're interested in learning more about anything that I talked about, or there are other things that I didn't mention in my slides, feel free to check out our website. I'm going to drop it in the chat for folks. And then one last thing I want to share is that we currently have applications open for our Advocacy Leadership Academy. This is a cohort style academy. It runs for 8 weeks for folks that are interested in becoming better advocates or learning more about policy. The application closes this Friday, and the first session will start. That was not the right. Is that the right one? Yes. Actually, no, sorry. That was a wrong link. There we go. You could see our application there for folks that are interested. The Academy is offered both in English and in Spanish. And the first session starts on May 13th, and it's offered in the evening times. So if anybody is interested in participating, highly encourage you all to apply. And then here are some resources for folks, both for state and federal, that I will share with you all, just so you can learn a little bit more about our federal nutrition programs, as well as this whole budget reconciliation talk as well. So, and that is all I have for you all today.
Thank you. That was a great and informative presentation. So I'd love to hear from folks in the room if you have questions. I think it shows up very clearly that this could be a definite issue for our region. I know that Lift Up has seen about an 800% increase in the number served, and so I'd love to hear if people have questions or thoughts. Well, I have one question. If someone's looking at for one thing they can start doing, what would you recommend?
I think building a relationship with both your state and federal legislators is one start. I find it super helpful to sign up for the newsletter for my congressional rep. I live in Crow's district, so when he had his town hall, I made sure to go. I submitted questions, sending emails with whenever there's an issue that has arisen that is of interest to you, to your rep, and also sending thank you when they vote yes for something that you support or no is also great to build relationships, because we want, you know, for reps that are very responsive to issues that are near and dear to our heart and they're in support of, we want to make sure that they are thanked for that as well. So I think that's always like my number one thing is identify who your legislators are, both at the state and federal level, and start building those relationships.
Thank you. Other questions or comments? Don't be shy. Thanks, Becca, for the feedback. It was a great presentation.
I dropped my email in the chat, so if folks do have questions, I'm like a crockpot thinker. I'm slow in processing. So if folks do have questions after the meeting and want to reach out, that's my email. If you have questions about our policy tracker, Advocacy Academy, happy to answer.
Thank you so much, and thanks for all of that great information. We'll forward any questions or let you know if there's questions for sure.
I had a quick question. This is Matt here. On the number for the if the broad-based eligibility goes away, there will be a certain number of folks who would lose. What is the primary reason why they would be losing that under that? I think it's helpful for folks to understand what's the trigger or what's different in that space in terms of, okay, this process goes away, people lose, but I don't know if everyone always understands why.
Yeah. So a lot of with broad-based categorical is like related to the asset limit changes that states can do. So if they were to remove the state's like flexibility on changing those asset limits, that would mean less people would qualify for the program. So they would be at risk of losing SNAP. And I think that's like the main thing is around the income level that states have that flexibility to offer. Does that help?
So so you would have some information that might be helpful for folks when they're talking to, if they're talking to representatives or anyone else around when they move this, what are they setting the limit at? Well, what is it
Yeah.
currently in Colorado, and why is that important? I think it would be really helpful information for folks to be empowered with.
Yeah, absolutely. That's a great call out.
Thanks, Matt. Okay, if there's no more questions, then we'll proceed on to talk about housing, affordable housing, and support for um, individuals or families experiencing homelessness. And obviously, there is a lot of correlation between all of these things: health access, food security, and housing security. So I'd like to introduce our next speaker, Brian Rossbert. He is the Executive Director of Housing Colorado. It's a nonprofit membership association representing the affordable housing community statewide. Brian grew up in Grand County, so he understands the rural mountain communities, attended Adams State College. He's worked in political and nonprofit spheres for his entire career and and enjoys that for the common good. So, Brian, without further ado, I will have you share about what's happening on the housing front. Hmm. We seem to be missing Brian. Let me reach out to him. In the meantime, why don't we see if people have suggestions around successes, challenges, and suggestions around topics for future quarterly meetings, just for a moment while I check in. And if you talk, you might get an Amazon gift card. Does that help?
Christina, I think we can revisit some of the chats that were put in earlier. I know Logan put in a comment about concerns around reproductive health. And then Matt Haynes commented, would love to talk about, excuse me, about the process and development of the next iteration of HTP.
Yeah, that would be great. Logan or Matt, do you want to share a little bit more about what you would like to talk about in the future around those two things?
Hi, this is Logan. I'm actually just really interested what other folks are doing about preparing for funding cuts, possibly to federal programs like ours. For example, our reproductive health funding, Title 10 funds many clinics across the country, and just recently, 22 of them, I think it was in 16 states, had frozen Title 10 funding specifically for reproductive health, which is a big one of our programs in the Upper Roaring Fork Valley. And I know other clinics and FQs depend on this funding. It's helpful for me to know kind of like like where funding sources are coming from our partners who might be a pass-through. So I'm trying to collect that information, but I really appreciate the presenters today who were breaking it down, because I'm not always sure where, municipalities and local government funding, where that comes from and how much that might impact a clinic like ours, the trickle down. So yeah, reproductive health is definitely a threat amongst other programs that we're supporting, but that's just a concern I have of mine. I was trying to find also a celebration, and I would just shout out to my staff that they're continuing to just keep going above and beyond for our clients, regardless of the fears and challenges they're hearing from folks, that they're just continuing to um, be present and work as hard as ever to just continue to make it like business as usual, even though we're all kind of having concerns. So that's really all I was wanting to share.
No, that sounds like a important thing to share. And if people have thoughts, please share, and then we can look at that for some follow-up. And I love that you shouted out to your staff members, because folks are still doing what we need to, which is serve folks. Any thoughts for Logan? Great. Matt, do you want to share briefly kind of about what you'd like to, and I think we can make that work to have you share in July.
I'd be happy to. Thanks, Christina. Hello, everyone. We are just starting some of the stakeholder engagement for the development of what happens after HTTP 1.0, HTTP 2.0. I think it's kind of the affectionate term that's going around. We are starting with principles, values to drive our decision making. We're doing that with some of the hospital work groups. We're then going to move into concepts and being able to continue to look at feedback we receive not only from hospitals, but from our RAs, from other stakeholders, and kind of culminating with kind of a big discussion around that at the Learning Symposium here, June 11th and 12th. I'll tell you a little bit more about that in a moment as well. I think July will be a good opportunity here to be able to bring kind of where all that is in terms of concept and guiding principles and ideas to a space like this that has representation across the delivery system and across even in patient advocacy and consumers as well. So I'd be honored and appreciative if I could use this great collective brain trust here to say, hey, here's how the concepts are shaking up. Here's what the ideas are looking like. Here's the direction we think is going to be most valuable for us to go to get your thoughts, feedback, and reactions to that, and to help us along that journey. I think would be extremely valuable for us in the process.
Thank you, Matt. Just so if there's anybody in here that doesn't know about HTTP or the RAE, will you give just a brief descriptor?
Absolutely. And I think I used an acronym there. I apologize, folks. I oversee something called the Hospital Transformation Program. It is a large hospital-driven program under the Colorado Healthcare Affordability and Sustainability Enterprise. All kinds of big words there for you. But we have a supplemental payment program. I'm lucky enough to be able to work in a space where we can use some of that supplemental financing to help incentivize delivery system change. The program focuses on hospitals putting in interventions to try to drive outcomes and measures, to be quite simple about it. We've pioneered a lot of areas such as health-related social needs screening in the inpatient setting, Rossbert in the emergency department, medication-assisted treatment, moving discharge diagnosis around behavioral health and substance use disorder. We've really been active, as I see Sherry there on my screen, in this program of moving data through the system as well, and making sure that if folks transition from acute care back to the community, that we're getting notifications moving through the system from the hospital to the regional accountable entities, in a large part utilizing the health information exchanges. We made a lot of strides there. We build the program around a cornerstone of community engagement. It's a requirement. And so we think it's been a groundbreaking program. I think it's got a lot of real positives, but I think there's a lot we've learned. We've always said it's a bridge to the future. It's given us good vision. Now we want to craft that vision into what comes next. And so love for y'all to be a part of that. If you want more information, I can drop the website in here in just a moment. There's a couple of places, some HTTP 101 and some different overviews of the program there you could check out. And then, as I mentioned, just as I opened, we have our learning symposium here coming up June 11th and 12th. We have a virtual option for that. I'll put the link to that website in as well. It's pretty wide open in terms of who can attend on the virtual side. It's a pretty great virtual experience too. So if you're interested and want to learn more about the things we're talking about in that learning symposium environment, feel free to attend that as well. I'll throw both of those links in just a moment. I think you might still be on mute there.
Thanks, Matt. I didn't realize, but Brian's coming at 1, so we'll wait and we'll continue the conversation. Becca, I saw your comment and I just wanted to share, but just from the presentations, Becca shared that the future needs of our underserved populations could be at risk. And then to continue to know from the county lift up and other agencies around food security and what is impacting the food providers. And we have our initiative, the Mountain Coalition for Food and Nutrition Security. And so they are continuing to meet and also looking at some areas where they're going to try to find funding for gaps or to maintain what is happening, which is awesome. The other, I wanted to share that all the hospitals in our region are part of HTP. So if you have questions, you can also talk to your hospitals. We've had presentations before from them about some of the interventions that they're doing. And now I was going to throw it over to Sherry to share about the transition from Quality Health Network to Contexture.
Oh, actually, Christina, I put in the comments that I will do that in July. It wasn't on the agenda for this meeting, so I don't have a PowerPoint presentation, but happy to do that in July.
Okay, perfect. Do you want to just share what's happening in case there's folks on the
Absolutely.
call?
Yeah, absolutely. So currently, right now, with our timelines that we are in, all data senders that were sending data into our health information exchange, we have been working with them to migrate their data feeds from the current QHN legacy platform that we are running over to the new Contexture platform that we will be using. That platform is going live January of 2026. Actually, we're going live Q4, so sometime in December, there will be a date announced of when are going live on that new platform. The second part of all of that activity is meeting with every one of our participants that are health information exchange participants and getting new Contexture contracts executed, along with doing account reviews with everyone, and then understanding the new pricing model and what that looks like as Contexture, as an HIE, serving our community as Contexture. So those are kind of like our next couple steps. And then again, our project management team, our technology team, they will be putting all of those projects in the queue to get all that data updated and running on the new platform. Both platforms will be running simultaneously to ensure that there's no issues. So we will be running those simultaneously, and then I hate to use this terminology, so air quotes, flip the switch on a certain date, and then we will be live on the new system, but definitely happy to give more updates in July about what that looks like. But hopefully for those of you that are health information exchange participants, that your engagement manager, Tina Hughes, has already reached out to you. And if she has not, you will probably be hearing from her very soon.
Thanks, Sherry.
Yeah, you bet.
I'd also like to ask, is there anyone in here who this is their first quarterly meeting? Give a thumbs up or... All right, everybody's been. Okay. Oh, Monica. Great. Nice to have. Do you want to introduce yourself since this is your first one? You're on mute.
Thank Thank you for that. Yes. Hi, everyone. My name is Monica Villalobos Russell, and I'm here representing the Salvation Army, the Vail Center. I've been in this position for 7 months, and I'm fairly new in my position and to this committee as well. So thank you.
Yeah, thanks for being here and welcome. Also, I just saw that someone put in a flyer for, and so wondering, Namrata, do you want to share about it? That'd be awesome.
Yeah, I did that. Thank you, Christina. So we have a full day impact for food and beverage advertising on children's health by Healthy Beverage Partnership on 30 April 2025 from 10 to 3. It's organized by Garfield County Public Health and McFinn's. So please RSVP. This is a platform where you can learn about what's going on around child health, around food and nutrition. So we would love to see you there if you're able to come. Thank you, Christina.
Yeah, thank you. And just FYI, this is also available to parents and caregivers and other folks as well. So if you know people who aren't in this room and you want to invite them, it's a great opportunity. And there's lunch served, which always helps. Okay. Anyone else have a success or challenge that they're experiencing that you'd love to share about? Or ways that this forum can be more helpful for you? One thing I am thinking about for July, when we do hybrid, it's always challenging for those who are online versus in person. And so probably part of it will be any presentations, and then we'll have the online folks do something interactive, and then the in-person folks do something interactive that will be separate. So we're looking at that as well. Hans, would you be comfortable sharing about the new name and kind of what's happening if you're able?
Sure, yeah. Happy to provide the group with an update. I think some of you have already gotten some information about our significant changes. It's been kind of a roller coaster last 90 days or so. I will skip a lot of some of those twists and turns and just let this group know that effective immediately, effective as of last week, the entity that was MindSprings Health is no longer. We are officially Health Solutions West. And for those of you who don't know what that means, we've effectively become a part of Health Solutions, which is a community mental health center out of Pueblo, Colorado. They've been around longer than MindSprings was, I think 62 years, formerly Spanish Peaks. Really just an amazing coming together of our two community mental health centers. We are under their operational control and have been, again, going through the process of changing our name to Health Solutions West. Jason Chabot is our new CEO, an amazing human being, and this is, I think, the best way for me to think about kind of the impact of what this means is, you know, we've had some significant scaling back and unfortunate programmatic closings prior to coming under Health Solutions, including closing West Springs Hospital, the only inpatient psychiatric hospital between Salt Lake City and the Front Range. I think it's fortunate that Vail Health Behavioral Health is getting ready to open their inpatient psychiatric hospital in Edwards. So that's good for the region, but it's still an impact for the Western Slope that we had to close our inpatient psychiatric hospital. Additionally, we had to make the unfortunate decision to close Glenwood Springs Withdrawal Management Facility. So kind of a scaling, kind of a focus, not kind of significant focusing of our programmatic efforts moving forward. And that will be what we are going to be doing as Health Solutions West, is a more focused outpatient and community facing program approach to Community Mental Health Center on the Western Slope. So that was a lot. I think it would take me a lot to unpack that and wasn't exactly prepared, but hopefully all of that makes sense. If you guys have any questions, please feel free to outreach me. My role will shift some, but only kind of expanding to kind of get back to a little bit more of outpatient operational support in addition to my regional outreach director role. You will see effective immediately that our email domains, anyone who is formerly affiliated with my team, my organization, will be healthsolutionswest.org email domain names. You will still be able to use our mindspringshealth.org emails for the time being. That should not get lost in translation, but that will be our new email domain that the region will start seeing immediately.
Thank you, Hans, and thanks for letting me put you on the spot a little bit.
Sure.
I knew you could handle it.
No problem.
All right. Before we have Brian speak, any other thoughts or comments? And then if not, I will welcome Brian to share. Okay. Wonderful. All right, Brian, welcome. I sort of read, I'll do just a quick revised bio because I read it. I started a little early, so I let them know that you're the executive director of Housing Colorado, and we look forward to hearing about legislation and what's happening around affordable housing and for those who are experiencing homelessness. Thanks for being here.
Sure. Thank you so much. It's good to be with you all. I just literally got back from another conference, so I appreciate your grace and me maybe running a couple minutes late. Glad to be with you. Again, my name is Brian Rossbert. I'm the Executive Director of Housing Colorado. We're a nonprofit membership association representing the affordable housing community in the state. And we do kind of two things. We do advocacy work on behalf of the industry and also education work. So we host webinars and forums and then a big conference in the fall. And I'm just so happy to be here. I did prepare some slides. I don't know if you have those, Christina. I sent them to.
Yeah, do you want Karina to share those? She'll be
Yeah,
happy.
that'd be great.
Yeah, just 1 second.
So kind of what we wanted to just chat today about was, there's a lot of housing legislation that's passed in the last few years, and wanted to just kind of give you an update on this current legislative session, which is running now through May 7th. So we've got about 3.5 more weeks left. We can go ahead and go to the next slide. So just to level set, kind of here's a quick agenda. I'll run through these pretty quick so we can get to questions if folks have those. We can go to the next slide. Just to set some context for us, there's a lot that's been happening. We could go to the next slide too. Thank you. Just a quick recap, the last session, there was a lot of housing bills, lots on land use and zoning and local control versus state control, as well as tax credits trying to fund affordable housing and homelessness response. We can go to the next one. And, the governor in his State of the State continues to make housing a priority and to talk about kind of what is happening in our state. And, I think it's really important to talk about, what his priority is around housing is to have more production of housing, not so preservation minded, although there are some strong advocates who are working in the preservation sphere, but to talk, more housing, unlocking prosperity, opportunity for folks at every budget, is kind of the underlining trend of his priorities. We can go to the next slide. Just a reminder that we have a Democratic trifecta in the state. Democrats are one seat away in both chambers of having a veto-proof majority, which means that they still have to work pretty closely with the governor and to make sure that legislation passes and is enacted. We go to the next one. Just real quickly, the budget is a mess. We're like $1 billion+ short in this year's budget, which largely housing programs have been spared from budget cuts, but that doesn't mean that next year, which will also be a hard budget year, will mean housing dollars aren't on the table, even things like Prop 123. So we'll see what happens in the next couple of years around the budget. And next slide. We can go to the next one too. So we're following a bunch of bills this year. One way to see what's going on is our bill tracker has a lot of information on it. And you can go to our website, housingcolorado.org, to find that. You can see there kind of what's in the bill tracker itself, but lots of good information. Next slide. So I've got 4 slides on bills that we're following. I don't want to go terribly deep into a lot of these, but I wanted to talk about a couple. 1019 is a bill that allows the Division of Housing to hire a third-party administrator to administer Office of Homeless Initiatives programs. This was kind of a technical fix that the department thought that they felt that they needed. So that hopefully OHI can get that third-party administrator up and running quickly. The other bill, 1032, the Improving Infrastructure to Reduce Homelessness bill, is a really kind of innovative idea. There's a few ideas in this bill, but one that I'm particularly excited about is the idea that local governments, much like they do already with regional housing authorities, could put together regional homelessness response authorities that would, pending voter approval, have the ability to collect tax revenue, to have homelessness response on a regional basis. We know that just like housing issues, the boundaries of local jurisdictions don't necessarily equate to an issue kind of not bleeding over those jurisdictional bounds. And so that would be an interesting implication of this bill. It would also do a couple of other things. One, kind of a re-engage and reignite a statewide, state level cabinet positions, having a homelessness council. So that would be interesting, as well as raising the document fee for real estate transactions, to be able to in the future be used for housing issues. There's been a lot, in addition to those 2 bills, there's been a lot around the landlord-tenant relationship. Really, again, this has been a trend over the last couple of years, strengthening the relationship in the direction of tenants, which I think is an important step, as long as some of the work that we've been doing is to try and insulate the affordable housing community from some of these things, not necessarily like warrant of habitability issues, or eviction issues, but on 1004, the bill you see at the top there, making sure that that the calculations that are used for setting rents for like LIHTC properties aren't affected by the algorithm bill that is being proposed. So we've been working on that. You could go through the next slide. Just trying to think of a couple other bills just to highlight. 1169 would allow an administrative review process for developments on faith or education land, which could mean more development at a reduced cost. We know that pet ownership, especially for folks experiencing homelessness, can be an issue getting into housing. And so we've been working with the ASPCA on 1207, which would allow for pet ownership in projects that are funded with state dollars. So, and then 1240 is trying to increase protections for tenants who have vouchers to ensure that they have even stronger protections than they do already. So lots going on in the housing world. We could go to the next, trying to think. These ones are more about production and funding for home ownership, but lots going on. There's some creative opportunities in terms of using existing state funds to help finance the construction and in some cases preservation of affordable housing. We can go to the last slide. And then Senate Bill 20 is an interesting one that we're monitoring that is really in response to the issues that were happening in Aurora at the edge of Lowry or Lowry Edge apartment complex where folks were living in really substandard conditions and would allow the Attorney General to uh, enter into a receivership for a property that is in extreme violation of warrant of habitability. So lots going on. I'm speaking really fast because I want to get really quickly to the next couple of slides and then get to your questions of just how to get involved in state politics. Your voice is always valued, I think, and really important to the process of making legislation. We could go to the next page and the next one after that. Sorry, that slide slipped in. One way to do that is to find your legislators, and you can do this on the General Assembly's webpage. Just enter your address. If you go to the next page, it'll pop up with who your state senator and who your state representative are. If you go to the next page, if you click into their webpage, this is what it looks like. Lots of good contact information. And I encourage you to really try and get to know your state senators and your state representatives. They are, I think I've found in a lot of cases, are always willing to have a meeting to hear what's going on in your world as someone who is working for, those on the margins. And, the example I'm giving here is just from our office downtown Denver. State Senator Julie Gonzalez is really amazing advocate, and she's really accessible. We can go to the next slide. There are lots of ways to be in touch with your representatives. If a bill is up that you want them to vote a certain way on, there's lots of ways to get in touch, call, email. Their website lots of times has good contact information. And then, when opportunities arise, and I encourage folks, really when the session's not in, to try and meet one-on-one with your legislators. They do appreciate those meetings and are, always willing to take them, show them, what you're working on. Maybe take them on a tour of your facility or a project that you're working on. If they're holding state or if they're holding town hall meetings, attend those and ask questions and really share your perspective. So there's always really good opportunities, I think, to communicate with your legislators. Go to the next slide. I'm happy to answer any questions. I know I ran through that pretty quick, and we could pop off, share screen and answer any questions about current legislation or what's happening at the state level. Thanks for running those slides for me.
Thank you, Brian. That's very helpful. I appreciate that. What questions do you guys have or thoughts you have around some of the things happening around affordable housing and homeless response?
None. Wow, that's a first. I guess I covered all of it, Christina. I'm always happy, and I'll put my email in the chat as well. Always happy to answer questions one-on-one, and reach out if there's a bill or anything. Oh, good, Barbara, I see you have your hand raised.
This is just a curious question, but could you speak a little bit more about the changes to like faith-based and school land use? Just
Sure.
Yeah.
Yeah, it's an interesting bill. It's affectionately called YIGBY, Yes in God's Backyard, plus education. Um, and what this would do is allow for an administrative review process for development on faith-based or nonprofit education land. So say a church had a piece of their property that once upon a time was going to be a youth center, and um, the congregation no longer is going to move in that direction. Rather than having to go through like a complete rezoning process, that it would have to go to like a town or city council, this would facilitate an administrative review process, which would save time and money for the development to take place. Originally, the bill didn't have affordability requirements in it, but we were able to, along with partners like the Coalition for the Homeless and Enterprise Community Partners, get some percentage requirements in there. So I think 20% of the units have to be available for folks making 80% or less of the area median income for a rental, and up to 120%, I think, for homeownership. So that's kind of the tact there. I do think there is a population minimum on that bill, and I'd have to go back, but in my mind, I'm thinking it's 5,000. So communities under 5,000 in population wouldn't be subject to that administrative review process.
Thank you.
Sure.
Yeah, thanks for clarifying. Brian, can you talk briefly about how some of this impacts? I know you were from a mountain rural resort community, but how this impacts our region specifically in Eagle, Garfield, and Pitkin?
Sure. Yeah, for folks who don't know me, which I think is most of the folks on the call, I'm from Grand County. I'm from Granby. My mom's the chamber director in Winter Park, so kind of know the resort community perspective pretty well, and that's where I was coming from. I was coming from the Colorado Mountain Housing Coalition conference up in Buena Vista. Um, you know, this year has been an interesting year in fact impact in that there hasn't been a whole lot of conversation around different um, uh, requirements for program funding that align with different regions of the state. Um, that's been a kind of um, a topic of conversation over the last few years, is higher AMI um, levels for mountain resort communities for state funding. So Prop 123 funding, 1308 funding from a couple of years ago, that mountain communities would be able to build to those higher area median incomes. I think, one of the things that we've been kind of trying to press along with those partners I mentioned on the YIGB bill is that um, need exists even in mountain communities for folks who are making very and extremely low incomes, that there continues to be a housing need in those communities, and that we can't just build to those higher AMIs, that something needs that kind of construction or preservation work really needs to be tied back to demonstrated housing need. So if a community has and communities will have to have these in the near future, like a housing needs assessment that says, look, you've got need at 60% or less of the area median income, that some proportion of what gets constructed with state money needs to be responsive to those demonstrated needs. I think in my mind, because the housing crisis is affecting higher and higher income folks, that it's become a little bit more politically expedient um, to talk about, folks who are, not that there isn't need for housing in our communities for folks making higher incomes, but we know that there continues to be need for low and extremely low income households for housing. I know that the stat here in the metro area is that 50% of renters are paying more than 50% of their income towards housing. And I can only imagine that is true, if not truer or higher, in our mountain communities. And so we're continuing to work on that, and how to best codify some of those perspectives, or some of those needs, and ensure that state resources especially are going to our most vulnerable folks in our communities.
Definitely. Thank you.
Mhm.
Yeah, I recently heard from someone, two people, um, a couple, and they are paying 4,000 a month in for their rent, and they're both working in the service industry. So lots
I don't
of
know how you make that work.
I don't either. Yeah. So many people, how do you make this work? But yeah, pretty impossible. Other questions or thoughts or just comments from all? I know it was a lot of information, so we're definitely going to be sharing all of that out. Cindy will be following up, but also just other questions for Brian and then other thoughts from the three presentations we had.
Hello, this is Jeff Cohen. I just had a quick follow-up on the sort of housing affordability. The Colorado Fiscal Institute has a really interesting project. I think it's the Colorado Unaffordability sort of housing project. And so they have some really good regional and kind of county level information on rental costs and then wages as well. And kind of looking at the gap between those two things. And yes, it's definitely as extreme in sort of mountain resort communities as metros for sure. So I think you can find that just by going to the Fiscal Institute site, but wanted to put a plug in for that resource.
That's a great call out, Jeff. And I think they use some data from I'm going to put the link to that in the chat, uh, from the National Low Income Housing Coalition in terms of like renter wage. We're the eighth most expensive state in the country when it comes to trying to afford a two-bedroom rental, according to that data. And it costs. I didn't have a chance to look it up, but it's north of $38 an hour to afford a two-bedroom rental is what a household would need to make. And I'm sure, and I know for a fact that that's higher in communities like Garfield and Pitkin, and you're in Eagle County, that renter wage is higher.
Thank you, Jeff, and thanks, Brian, for being willing to share. We're nearing the end, so any final thoughts or comments? Actually, we got a little bit of time. Okay. Well, thanks everybody for listening, and please reach out with questions, and if you didn't get people's contact, we'll definitely share that. Sherry, do you want to close us out?
Sure. Yeah, we had a bunch of great speakers today, so thank you, Brian, for joining us today. Lots of good information around housing. And thanks to all of you, which are our community members, for taking time out of your day to listen and learn. We appreciate your collaboration with our alliance. And so thank you very much. But I hope you all will enjoy the spring weather while it lasts. I see there's a cold front coming in this weekend, which is not surprising. It's Colorado. So nonetheless, I hope you all enjoy your time. And Christina, our next quarterly meeting, just as a reminder, will you give us that date?
Yeah, it's Monday, July 14th.
Great.
And that will be hybrid, so there will be a chance to be in person and also an online piece.
Perfect. Well, I look forward to our next discussion, and I hope you all enjoy the spring.
Yep. Thanks, everyone.
Thank you. Have a good week.
David, how did that go for you? Did that work out okay?